When we are sick, conventional wisdom tells us to take it easy, to make sure to rest and minimize exertion when possible. The problem with this is that our lungs rely on gravity and movement to stay healthy. When we change positions, we are able to recruit different parts of our lungs, expanding them to involve them in breathing. Position change strategies have long been used by medical professionals to treat very sick patients in the acute care hospital.
During this pandemic of the coronavirus, it's actually been shown that by taking a patient who has pneumonia, respiratory compromise, that they may improve their oxygen, probably do improve their oxygen, by turning them from their back to their front. This positioning change is called proning, and what it does is it recruits alveoli, or the air sacs, that are having a tendency to shut down to actually open up. Patients who are less severely ill may be able on their own to also change position and perhaps improve, if not prevent, further collapse and improve their oxygenation.
In this video, you will see a progression of 4 different positions that will be beneficial for the overall health of your lungs that can be done on your own at home. If, for any reason, you are unable to assume a position, there are modifications provided. We will start with lying flat on your back. A less strenuous modification can be to elevate your shoulders on a pillow. Now, rest both of your hands gently on the side of your ribs. Feel your rib cage open and expand with each breath. And try to track the movement with your palms. See if you can make your breaths deeper and longer, but without straining. Keep your shoulders relaxed. This is a good breathing warm-up for 3 to 5 minutes. Next, we have a right side lying position. As shown here, the hips are elevated above the shoulders. This is to help expand the lower parts of the lung. If this position is difficult, you can elevate your shoulders above your hips on a pillow, as shown. An even less strenuous modification can be sitting, leaning to the right side. From this position, you can add movement of your left arm with your breathing to increase the stretch. Take a deep sigh or inhale as you lift your arm up over your head, and exhale as you bring it down by your side. Try to have a cycle of 4 to 5 deep breaths with this movement. For a second movement, use your arm to rotate or turn your trunk side to side. Again, use your breathing. Inhale deeply as you lift up and out, and then exhale as you bring your arm back towards the ground. The third position is lying on your stomach. Again, notice how the shoulders are below the hips, causing the trunk to lean forward. This position will be helpful to expand the lower back part of your lungs. Only attempt this position if you are positive that it is safe for you to do so. Modifications are seen here. Leaning from a low couch to the floor, kneeling over a pillow, sitting forward on your elbows, or sitting forward at a table, leaning on your arms. Once in the position on your stomach, there are no additional movements to add. Try to remain in this position for up to 10 minutes if you feel comfortable. Listen to a podcast, some music, or grab a nice book. Just simply hanging out in this position allows gravity to help keep your lungs healthy. For the fourth and final position, you're going to repeat the progression of movements and breathing from lying on your right side, only now lying on your left side. We recommend you repeat this progression of movement and positions 3 to 4 times in a day. We hope that you enjoyed watching our video and that you're able to breathe a little bit easier.